my index cards right here. I'm sure you've heard the term breast is best, but have you ever observed the reaction to breastfeeding in public? Hello everyone, my name is Savannah Seaton, and today I'm going to be talking to you about the stigma behind breastfeeding in public and the benefits of breastfeeding that need to be considered as we work to destigmatize the act. Now you might be wondering when the stigma itself actually began, because in olden times, breastfeeding was actually considered an act of the higher class, and wet nurses were actually hired to feed infants of the wealthy. However, during the 19th century and the breakout of World War II, women were needed to return back to the workforce and create supplies and necessities for the war. Therefore, they were no longer home feeding the children. Rosie the Riveter, as she broke out and created propaganda for the war, she also encouraged an emergence and independence of women during this time period. As we shifted into the 20th century, according to Cecilia Tamari, the emergence of formula and artificial milk substitutions pushed for breastfeeding to be viewed as a lower class act and poverty, as if people could not afford to buy these products, so they were forced to breastfeed. As we had other options beside breastfeeding, the female breast started to be exclusively viewed as a sexual object instead of the maternal aspect it is originally made for. As these times have gone on, the stigma itself has carried over, and it has carried over for a handful of reasons. One of the main reasons is going to be the structural inequality of gender bias. Breastfeeding is obviously a gendered behavior, as men cannot breastfeed, so it has been a target against women themselves. Specifically in the Western culture, like the United States, the sexual role and desire of the female breast has been blown out of the water through benevolent sexism. In an article called "It's Just a Breast, an examination of the effects of sexualization, sexism, and breastfeeding familiarity on evaluations of public breastfeeding," it has been shown that benevolent sexism has been extremely viewed and advertised in not only advertisement, but TVs and movies and all of these forms of entertainment that we use every single day. As we acknowledge the fact that the female breast has been viewed in a sexual manner and only as a sexual manner, we have created and acknowledged a lot of uncomfortable situations for breastfeeding moms. According to Views and Experiences of Breastfeeding in Public, a qualitative system review, a handful of reports have been made. Some listing that men have behaved sexually towards a mother who is breastfeeding, men who have masturbated in front of women who are breastfeeding, and even older women we have seen rip off covers of mothers who have been breastfeeding their children. Incidents such as these have led to a reported 18.6% of women stopping breastfeeding within the first 1 to 2 months of their children's lives, according to an article called "It's Just a Breast." With this statistic in mind, we have to acknowledge the fact that the FDA and the U.S. dietary guidelines suggest a minimum of the first 6 months of a child's life to be exclusively breastfed for the benefits that we will discuss in a little bit. Not only have these uncomfortable situations occurred and developed, but we also sometimes experience hostile environments that can cause a much bigger problem. Mothers have reported receiving negative gestures, comments, looks, twits of disgust, and even, according to Amy Grant, mothers have received physical and sexual threats in public settings. Although there have been options and we have exercised situations and utilized different programs or even objects to help push off these situations, they always haven't worked. Mothers have reported using scarves or breastfeeding covers to cover the baby as they feed, avoiding eye contact to avoid any opportunity for interaction with other observers. There have been, I don't know if you've ever noticed while you're out and about, but some places do provide a private room for mothers to breastfeed. We see them sometimes in gas stations, like on the thruway. We will see them in airports. Places like that, you may have seen these in the past. However, private rooms do not destigmatize public breastfeeding. All it does is make a secluded feeding once again. Some mothers, however, unfortunately have fed in bathrooms or even their cars just to avoid these types of encounters. The company of other breastfeeding moms has also been reported to help mothers be more comfortable in a situation. However, this shouldn't be necessary. The isolation and mental strain on mothers who breastfeed in a public setting is taunting. Again, on an article published from Amy Grant, the mental strain is extremely difficult on the mother's mental health, and postpartum mental health problems are a huge concern in the United States right now. Not only has these religious beliefs, old-time thoughts, and understandings of breastfeeding have encouraged uncomfortable situations and hostile environments, but also the lack of knowledge and exposure to breastfeeding itself. Some people have assumed that mothers breastfeed the child based on their preferences alone and not the infant's cues. Or some people even believe that breast milk is a dangerous pollution or even a biohazard to other observers in the area. Again, this assumption is based on a mother's sexuality and not the maternal aspect that she is trying to provide for her child. According to Amy Grant, some mothers have even been denied the right to breastfeed their children in a public setting like a restaurant. Even though their legal right is to breastfeed, it is cause for an environment and mothers have left these scenarios. Like I said earlier in the video, that we have so many benefits that need to be considered before we judge or create an environment that's uncomfortable for a mother. Breastfeeding has been reported, according to the maternal health benefits of breastfeeding, to not only lower pediatric infections like pneumonia, but lower pediatric immune disorders like irritable bowel syndrome, and it lowers the risk of death in their first year of life from a cause such as SIDS. Not only does the child benefit from breastfeeding, but the mother does as well. Breastfeeding can lower the probability of a mother receiving hypertension treatment, as hypertension will be lowered. There is a high probability if they breastfeed. Not only is there a probability of a lower chance of hypertension, but also breast and ovarian cancer for mothers who breastfeed compared to mothers who don't breastfeed. Maternal obesity later in life is also a lower risk for mothers who breastfeed in comparison to those that don't. And developing cardiovascular disease is also a lower risk. Not only do the mother and the baby both benefit from health benefits of breastfeeding, it also provides for a fantastic opportunity for bonding to build their relationship in the baby's life, especially in the first few years of their lives. However, although we have this gigantic stigma and hostile reaction to breastfeeding in public, there has been some advocacy and support breakthroughs within the recent years. According to an article called "The Way to Break the Taboo Thing is to Do the Taboo Thing," an article based on activism in the United Kingdom specifically, the National Health Service promotes campaigns for breastfeeding. They highlight and focus on National Breastfeeding Week in the month of August and provide training and information to midwives and home health visitors. Along with that, not only in the United Kingdom, in the United States and other surrounding countries, there has been a breakthrough of the term lactivism, which is a taboo, if you will, term for activism with lactation for breastfeeding. They have promoted nurses to help mothers be more comfortable in a public setting and to destigmatize a reported previously hostile environment where a mother has tried to breastfeed, as well as breastfeeding picnics to break through to the general public. Now, we look back on breastfeeding and the stigma starting in the 1900s. We have grown as not only humans, but societies, countries, religions, and overall just a general understanding of how things work. I think it is important to acknowledge all the health benefits of breastfeeding for both the mother and the baby, and to return back to acknowledging the maternal aspect of breastfeeding compared to the lack of knowledge, exposure, and the unfortunate sexualization of the female breast. Thank you guys for listening and have a great day.